So as the patient came with fever, body ache and joint pain and is given NSAIDs for the treatment. After few days, he developed brownish pigmentation over the nose. The diagnosis is fixed drug eruption, chikungunya, dengue and melasma. Now see, after giving certain drugs like NSAIDs, the patient developed brownish pigmentation. So many of you might think that the answer is fixed drug eruption. Now, fixed drug eruption happens acutely, means just after taking the drug within 30 minutes to 8 hours, the symptoms, that means the rash or the skin lesions, will appear. And that is seen mostly with NSAIDs, paracetamol, and cotrimoxazole. Okay, this effect, this rashes will be there in many areas, but particularly it is seen in genitalia and lips. Particularly it is seen in, these lesions are seen in genitalia and lips. And every time the person is taking that offending drug, the lesion will appear in that same area. Okay, it's a type 4 hypersensitivity. It's a delayed type of hypersensitivity, or it's a type 4 hypersensitivity. Now, this patient developed those kind of rash, those kind of hyperpigmentation after few days. That means fixed drug eruption won't be the answer here. Now, the patient is having typically the joint pain, fever, and this kind of symptoms are not associated with melasma. So melasma is also out of the option. Now we are left with chikungunya and dengue. So obviously dengue won't be the answer here. The answer will be chikungunya. Now why this is the answer? See, the patient is having fever, joint pain, and typically the nose pigmentation that is seen is a macular lesion, okay, over the nose. The macular hyperpigmentation that happens, that is known as post chikungunya hyperpigmentation. That is known as post chikungunya hyperpigmentation over the nose, and this is what is known as chick shine. That is what is known as chick shine. Okay, and typically it happens after the fever subsides. So once the fever subsides, then this once the fever subsides, this will appear, this rash will appear, and this will persist for 3 to 6 months. This will persist for 3 to 6 months. Okay, and mostly it appears around the nose and cheeks. Nose and cheeks, this is very important. So the patient will be having fever, joint pain, and typically there will be nose pigmentation that happens, that is a macular hyperpigmentation. In case of drugs, there will be vesicobulous rashes will be there, and after that, that might heal with this pigmentation, hyperpigmentation. Okay, so this is how you can differentiate. So you can see this images also. This is what is seen here is the typical of post chikungunya chick sign. It's not, it is seen in the nose here, but it also involves the chicks. Okay, and this is what is fixed drug eruption following NSAIDs or paracetamol. You can see